All right, well, welcome everybody. Welcome to the Building Bellingham series called Pivot. Our whole focus is on focusing on what we can control, taking the positives, the silver linings out of everything, and focusing on what we're doing right now, how our lives have changed, but really how we're going to change the way that we do business and how we are as humans going forward. So I've got some amazing guests here on the show, some that I'm just meeting now, but also people that I know from college, from other groups, from family, friends, other industries. So welcome everybody. Thanks for joining us.
Thanks for having me.
Thank you. Happy to be
So
here.
yeah, thank you for being here. So I'm going to start off, and I don't know if the tiles on the Zoom call are all the same for everybody, but I'll just, start off with Kristen up here in the upper left corner. Kristen Hill, would you like to introduce yourself? Tell us a little bit more about yourself and what you do and how you're involved in healthcare.
Yeah, I am a registered dental hygienist. I graduated from the Shoreline Community College program in the summer of 2018. So I haven't even been practicing for 2 years. I know Leo here from college up at Western. Yeah, as of right now, all dental practices are closed except for emergencies until at least May 18th. So we're kind of anticipating that to be extended out a little bit. So we're just kind of all up in the air right now, trying to roll with the punches and see what happens.
Just figuring out as you go. Very, very good. Well, thanks for joining us. And Lise Waugh, you are somebody that I've known for a long time. So Lise, tell us a little bit more about yourself, who you are, what you do, and yeah.
Okay, so I'm Lise Waugh, and I own a yoga therapy and massage therapy studio in Bellingham called the Metta Center. And at the Metta Center, our yoga therapy programs are really intended for individuals who have different diagnoses, like we work with people with MS and Parkinson's, arthritis. So yoga therapy being a little bit different than a yoga studio, most yoga studios. And then we have the massage therapy component. My specialty is in Thai medical massage, and I've been doing the Thai massage for 20 years, yoga therapy for 30 years. And so we had somebody new pop in too.
Hello.
Sorry, I had to finish up with a patient. I was running a little behind.
Well, you sound like the perfect person for this call if you're just finishing up with a patient.
Yeah.
We're just going. Yeah, go ahead.
Yeah, so my business has really been impacted from the sense that we can't do our hands-on treatments, obviously, for the time being. Massage therapy in Washington State has kind of been given some mixed messages from the Department of Health. So some massage therapists are considered essential because they do medical massage, work with chiropractors, whatnot. But most of us have taken the understanding that we need to not be practicing. Most of us not working in those acute kind of conditions. So I've really been learning a lot about Zoom. This has opened up a whole new world for me, and I'm still figuring it out, but offering yoga therapy sessions to clients distance-wise, that's new, and I'm learning. Offering self-help treatments to clients, stuff like that.
Awesome.
So.
Thanks for sharing. And Adam?
I'm Adam Fanoff. I am a chiropractor here in Bellingham. I own a practice called Apex Chiropractic and Rehab. So what I do a lot of is a lot of exercise prescription and manual therapy. So that's kind of hands-on muscle work. So those are a big part of my practice. And I work with a lot of outdoor athletes, endurance athletes, so cyclists, runners, skiers, hikers, paddlers, stuff like that. So I see a lot of chronic overuse tendonitis conditions and occasionally some traumatic injuries that are kind of specific to those sports. So a lot of my practice has been definitely affected by this. I do a lot of exercise, but I also do a fair amount of manual therapy. So I can't really do that at this time. Like it's been said before, it's being in a close proximity with somebody without the proper PPE it's a risk to yourself and a risk to others. And so a lot of us that are considered essential providers have made a decision not to get into close contact with people. Again, that was a personal choice, but the long and short of it is I've been doing a lot of telemedicine at this point. It's been really successful, actually. I didn't have high expectations for it, but it's been really great. Been using an app called Doxy.me, and it's a nice HIPAA compliant software. Allows me to take histories, offer exercise prescriptions, self-management. Even in acute cases, it's been impactful for people. So I've definitely been astounded with the progress that I've had with new cases and continuing cases during that time, or this time.
Awesome. Thanks for sharing. And Emily, thank you for joining us. Tell us a little bit more about yourself.
Hi, I'm Dr. Sharp. Oh boy, I went to Western. I think I've been a doctor for 14 years, so I lost track. I am a naturopathic doctor. I specialize in hormones, mostly thyroid, adrenal, fertility, and menopause are my top ones that I thoroughly enjoy. It's never boring. We've been doing 100% telemedicine, also via DoxyMe for feels like forever. Since my mom's birthday, actually, March 14th, I was supposed to be hosting her birthday and instead was in the office on a Saturday getting it all set up, which was much easier than I was anticipating. And it's been actually kind of amazing being able to use DoxyMe. I haven't expanded to the fancy version yet, but I'm anticipating after my couple days off, I'm going to do that. I've also done some Zoom counseling personally, which went really very well. I was finishing up this whiplash PTSD thing, and she had never done this particular accelerated resolution therapy before. And so I was like, I'm a good person to practice on and experiment with. And it went really well. So I've also managed to screw up my knee in the middle of this and gardening, and did a physical therapy Zoom or Doxy, I can't remember which one. And it was absolutely incredible. I could not believe the amount of help that I had instantly.
Awesome. Thank you for sharing. Thanks for joining us. Vanessa.
Hello. Well, my name is Vanessa Perry, and I'm a registered nurse at our local hospital here in Bellingham. And so Peace Health St. Joseph Medical Center. I work in the cardiac recovery unit. We're an outpatient unit. We do prep and recovery of cardiovascular patients. I also do sedation procedures in that unit. I've been in healthcare for 30 years, 20 of which as an RN, 5 years before that as an LPN, and 5 years before that CNA. So I've been in healthcare a while. This is different for sure.
Thanks for joining us. And Dr. Beatty, thanks for joining us.
Yeah, thanks for having me. Whoa, I'm still in my roller chair. Sorry, I'm at the office. I just rolled away.
So tell us a little bit more about yourself and who you are, what you do. And
Yeah, so like Dr. Sharp, I'm a naturopathic physician. And my specialty is really sort of a broad umbrella of regenerative medicine. I do a lot of joint injections for orthopedic rehab, which obviously is changing the way I practice with patients. And then so I see most of my patients I see at a clinic in Woodinville called Sophia Health Institute. I work with a team of about 8 other physicians. Most of the patients that we see are patients dealing with chronic illness. So I'm doing a lot of ozone injections. I'm doing a lot of perineural injection therapy, neural therapy, prolotherapy, platelet-rich plasma, exosomes, and biological allografts. And I mean, all this stuff that really requires a lot of hands-on therapy. I also work in the IV room there, doing a lot of IVs. And then here in Bellingham, I work with Dr. Brendan Whitty, another naturopathic physician, and we specialize in hormone care as well. and are mostly known for pellets. We're part of the BioT pellet procedure group. It's a national group. So we actually are still seeing patients at both clinics, both in Woodinville at Sophia Health Institute and here in Fairhaven at Cedar Mayo. And part of that is we're still doing a lot of telemedicine like everyone else. If we can move the visit to a telemedicine visit, then we do that. And the patient that I was finishing up with before I jumped on here was a telemedicine visit as well. But the pellets are something that obviously is a procedure that has to be done. And for some of our patients, they came from such extremely low places that even just the idea of not being able to maintain where they're at creates so much anxiety and stress, and the mental health aspect of it becomes almost unmanageable to do other than in person. So I think we're kind of navigating it day by day, whether or not we can see a patient. We're encouraging patients who can delay treatment or switch to injectables that they can do at home, or other means of dosing to do so, but it's just not possible for all people. And then for the patients that I see in Woodinville, some of them are so medically fragile that if they don't have constant care, then they become a burden on the hospital system. So part of being able to be available to them in practice is keeping them out of the hospital setting.
Understood. Well, thanks for sharing. And interestingly enough, one thing I'm hearing as a commonality between all of you is that with this big challenge, which is clearly a health and wellness challenge that we're going through right now, one of the things I'm hearing is that most of you are getting used to Zoom, telemedicine. There's lots of different pieces that you've had to pivot as far as technology goes to continue running your practice. Tell me a little bit more, and this is open, tell me a little bit more about what that's been like for you all, pivoting your business from obviously needing to be hands-on in person to having to adjust to this world. And please feel free, anybody, to start off.
Well, I'll take that, I guess. I think that as providers, I think one of our biggest skills that we have at our disposal is communication. Communication is the number one component to a relationship between a provider and a patient. And that means both with taking a good history, which is 90% of the game, and then moving forward and following through with recommendations for that individual, and providing them assurance. I think that those are the most important parts of a relationship with a patient. And it's something that we can still provide with telemedicine for the most part. There's always exceptions, of course. But that's been something that I've found during my experience over the last 4 weeks of doing telemedicine. And I imagine that you guys have all had similar experiences, but I won't speak for you on that one.
Yeah, actually really surprised at the level of grace and understanding and acceptance. And maybe they were in shock in the beginning, but I think patients did a really good job. When we just suddenly on a Saturday sent a message that said, it's going to be 100% telemedicine. If you have B injections, we will teach you how to do that. And then, I have the luxury of being able to do almost everything telemedicine. And then we have a very large dispensary. So that has been phone and DoxyMe and power to patient orders. And then they knock and pick it up so some logistical things, but I'm very happy with how people are handling things for the most part.
So seeing a really good response from your clients by setting the expectation that this is the new normal, this is the new way that we have to do business, especially because you all are walking a very fine line between you being able to do your job at the best possible capacity and ultimately being on the front end in different ways for helping people maintain their health. Lise, were you going to say something about that?
Yeah. I think for us, it was just this sudden, full stop, and caught us very off guard. What do we do? And kind of a scramble, because we didn't have telemedicine in place for us. Most of us didn't really have the knowledge how we could be serving our clients virtually. So it took a little bit of time for us to react and to learn. And I've been taking classes so I can up my game, my understanding. I've been taking all these classes on how to use Zoom and how to do live videos and reaching out to the clients. And like Emily said, they've been very, very gracious. They've been very understanding. They're used to coming in and receiving touch. And now, well, obviously we can't do touch. And what I'm learning is that a lot of my clients are wanting to hear my voice. So leading guided meditations and these things to help tame their anxieties, to bring them into a calmer place, in addition to teaching them exercises that they can be doing. But I'm still just figuring it out every day. I'm learning things from this group here on how I can continue to build this new platform.
Yeah, that's awesome.
For us,
Go
I
ahead.
think for us, it wasn't as big a leap because we already, at Sophia, we see patients from all over the world. And so we're used to having to connect with them remotely when they go back to wherever it is they live. So we already had a lot of that in place. What changed drastically for us was trying to limit the number of people who were coming in to the clinic who were local, I guess. So I feel like one of the things that's been really beneficial is that some of our patients, especially for me, I think patients sometimes become a bit reliant on the touch therapy and the face-to-face contact that they have with you, which is not necessarily a bad thing, but it allows some neglect, I guess, of some of the sort of foundational things that we would like to see our patients doing with diet and nutrition and meditation and a lot of the educational pieces that we're typically trying to get our patients to do. So now that our patients are stuck at home, a lot of them are spending a lot more time really learning all of the educational pieces that we've been offering them all along, but that they haven't maybe had the space or bandwidth to incorporate in. And I think that's actually a really positive thing that's come out of this, is that patients, at least my patient population, is really circling back to a lot of the foundational work that we try to do with them anyway, apart from the injections.
So you're saying it's the silver lining for you is that, and I think everybody that runs a business that has some set of customers or clients or people that rely on them for their service, I think we can all agree that there are certain pieces to each one of our professions, our careers, our jobs, that it would make it a whole lot easier if they just did the foundational work. Like for us, it's like, go get pre-qualified before you start looking at homes. It's not for me, it's for you. Like
Right.
It really is. And so I think that I really love hearing that silver lining in there, that people are starting to focus more on their health and their wellness, which it's too bad that it takes something of this scale and of this, negativity to come in and kind of smack us in the forehead and say, you should be doing this every day. You shouldn't just be drinking a good smoothie every day or stretching every day or I'm like barely hitting the tip of the iceberg for what you all do. But like, this is like an opportunity for everyone to reset and understand they have to do that. Kristen, for someone that like directly is working on people's mouths, tell me a little bit about your experience with, like, after you found out about all of this COVID-19 and the fact that you've been working on people's mouths. Like, what was that moment like for you?
Pretty scary, actually. We initially found out about it and we're like, it's not really gonna hit our city or anything like that. And then it was in our city, and pretty much immediately our boss, my dentist, his wife is like very, very immunocompromised. And so he just shut down our office pretty much immediately. We were closed the week of the 15th. That was the first week that we were closed. And then a few days later, they put out the order that all dental offices should be shut down except for emergency procedures. So yeah, it's been really scary. We're one of the highest risk professions we're sitting in a chair for 9 to 10 hours a day with a patient, creating aerosols for pretty much that entire time. And those aerosols can sit in the air for 3+ hours. We're not using N95 masks. I think in the state of Washington, we're required to use level 3 masks, which filter out a fair amount of particles, but they have gappage and all this stuff. So it's pretty scary. I was just watching a video yesterday of the president of the American Dental Hygienists Association, and they were talking about post-coronavirus, post-COVID-19, almost requiring dentists to have negative pressure operatories and to treat patients in negative pressure operatories, which is not feasible for anybody, I don't think. So there's going to be a lot of changes after this to PPE, and that's pretty scary too, because there's such a shortage right now for doctors and nurses and everybody, that we don't know where we're going to get that equipment, if there's going to be enough for us. So we don't know when we're going to go back to work. I don't want to go back to work personally unless I have the N95 and the face shield, and we have gowns at work and everything, but we just don't know where we're going to get that personal protective equipment. It's scary. I mean, I don't know.
So on that topic of PPE, Vanessa, can you debunk a myth for people that are going to watch this video? Because I see people walking around with masks on, and my understanding is that if you are infected with any sort of disease, then maybe it filters out only a certain category of diseases or viruses or whatever it may be. But I think what I've seen, and maybe the masses of people that think that that's protecting them from other people, is that protecting you from them or them from you? How does that work?
Well, here's the thing, because I know there's been a lot of confusion with masks. As a healthcare professional, when we go into an isolation room, we're wearing masks for droplet isolation. So, theoretically, it should protect the person wearing the mask from the droplets. But you have to wear the mask properly. So one of the things I see people doing out in public is they have the mask, below their nose is sticking out, or they're playing with it all the time, or they're pulling on it, or they take it off and they set it somewhere. So it's like you're getting germs on the inside of the mask, and probably, it's worse than not wearing a mask if you're not going to wear it properly, because you're touching your face so much and your mask. So as far as masks out in public, I mean, I think people should wear one. Like if you're going to the grocery store, obviously not going out at all is ideal, but we all need things from time to time. So like my husband, Mike, he went to the grocery store last time, and I said, wear this mask, obviously stay 6 feet away from people as much as you can. But he wore the mask and he just hated it. He got home and he was like, that was the worst experience of my life. Like the ordinary people aren't used to having a mask on their face, and it is not the most comfortable thing. And they smell funny and they irritate your skin for some people. And so I think wearing them for short periods of time, only when you have to go out and be within 6 feet of people, like a grocery store, should the general public wear them. You don't need to wear them driving around in your car by yourself. You don't need to wear them on a walk where there's nobody around. But yeah, within that 6 feet distance, definitely. And the other thing is, because there's people with COVID that are not portraying any symptoms or very mild symptoms, I feel it's also important, like for me as a nurse, I'm exposed to COVID more than the general population. And so I want to wear a mask in those settings, like a grocery store, so that I don't infect other people with COVID, because you don't know if you have it. And you also don't know, they have the super spreaders. So people who can really spread a lot of the virus to a lot of people. And I just don't want to be that person.
What can you clarify what a super spreader is? Because that sounds like something from a superhero movie.
Yeah. And I think I got the lingo wrong, but It's someone who, for whatever reason, is able to spread the virus more easily to a large amount of people.
A shedder.
Shedder, thank you. Yeah.
So do these people have arrows pointing over their head? Can we see them on the street, or how do we identify a super shedder?
A couple.
Hey, any of us on this call could be a super spreader. We don't know.
Good to know. Yeah. So I think to take away from that, like from me not being involved in the medical world like you all are, as just kind of your average Joe, the masks are important in certain situations and with specific types of uses. So not like you don't have to wear them all the time. In fact, probably the more often you wear one mask, the more likely that is to have any sort of virus or disease on it or whatever it may be. So it comes down to the logical use of it. And I think we don't need to dive into the lack of logic that our society has in a lot of different ways, but yeah, tell me more about that. So you're now pivoting your businesses. You're seeing all of this happening. What information do you all believe? Like, where do you get your source of information? Because I feel like there's so much that's spreading like more of a virus than I think the actual virus is. Does anybody want to dive into that a little bit? Like what's your source of information as a healthcare professional?
I can hear, go ahead, Adam.
Oh no, you can go ahead, Summer.
So being here in Washington, the naturopathic profession has a pretty strong organization at the state level. So we have the WAMP, the Washington Association of Naturopathic Physicians. We have a national organization, the American Association of Naturopathic Physicians. So for naturopathic doctors, we have those two resources here in Washington, which have done a really good job of putting out a lot of information for providers in our profession. So I've definitely looked at some of the stuff that they have. So I think pretty much just, and then being at Sophia, which is a globally connected clinic, we have access to a lot of physicians from all over the world, physicians who are in the middle of this, who are doing research, who have been doing research on these types of viruses for a long time. So definitely we've been tapping into some of our physicians from Italy, some of our physicians from Asia. They're doing webinars and educational videos for our staff. But I think that there are, like you said, it's hard. And so one of the things I've actually been telling a lot of my patients to do is just turn off the news. If it's really bad and they really need to know, they'll find out. The state will make sure people are updated. But I think that one of the biggest concerns I have is that people have sort of tapped into almost an addiction of following the news and the updates. And it creates all of this aberrant brain firing that really is triggering a lot more dis-ease than is necessary for people. So I'm really asking people to, if they're part of our care community, to rely on us to let them know what they need, and then to just pay attention to the state and local, like Whatcom Health Department sends out periodic updates. And then aside from that, to kind of just really ignore the news and stay off the social media. I've pretty much gone through my social media feed and just turned off, like I didn't unfollow people, but I pretty much just turned off almost everyone, because everyone from your neighbor to your bank teller is posting stuff about COVID all day long. And it's not good for mental and emotional health.
Yeah. So just to clarify, there is a snooze button. So you can snooze people for 30 days, which you can just keep doing it if they keep popping up with negative information. So I think, there's a snooze and you can unfollow. If it gets too much, you can unfollow. So just for the social media part, that's something that I think I probably snoozed 50 or 60 people on my social media. Felt awesome. Adam, sorry.
Oh yeah, I was gonna say, piggybacking off what Summer was talking about, state associations for each respective profession have been really good with issuing recommendations and updating them. I know there were recently updated guidelines issued just yesterday or the day prior. And I think that we need to all bear in mind too, everybody's looking at all these different statistics. Everybody's, paying so much close attention to everything, all the news that's coming out. And really when it boils down to statistics, the problem is we don't have a huge sample size to work with. Testing is still not happening on a large enough scale for us to really be able to dive into the numbers. So a lot of people are using it to fit whatever narrative they have set up for themselves. whether, oh, it's not that bad, or, oh, this is really bad. It's really hard to tell when you have, say, for example, 150 people have been tested and say 50 people have tested positive for COVID. Well, that sounds pretty bad, doesn't it? Percentage wise. But when you look at the sample size, 150 people is a very small number. And so really, until we have a large scale, broad amount of testing, it's going to be very difficult to come to any conclusions. But people are using this as an opportunity to create some false assumptions or create false conclusions. And really, it's just getting everybody worried. And I think, yeah, turning it off and trying not to pay too much attention to it until we have a much clearer picture is a really important thing. Another thing that I've been looking at is there's been a handful of studies coming out of Singapore in particular. They had to deal with SARS virus a number of years ago, and then they've dealt with COVID as well. And they have a lot of great recommendations for healthcare providers. Obviously, it's kind of contingent on having the proper PPE, but at least in the hospital setting, they've been doing a lot of great research and cohort studies that really make it they're able to ensure more safety for providers and ensure more safety for those who are not infected in a hospital setting. They had a lot of issue with, back when the SARS outbreak occurred a number of years ago, they had a lot of difficulty with healthy people getting sick in hospitals. And so what they decided to do was, cohort both providers and cohort patients, so there's no crossover. And then obviously they ended up stocking up on a lot of PPE since that time. Looking to what others have done and what others are finding out, especially in countries that have encountered COVID prior to us, can be a very helpful resource for medical providers and our healthcare system in general. Obviously, one individual, like somebody sitting at home, there's not a lot that we can do on a small scale other than do what we can to social distance, like you've all been talking about. Especially like with mask use, limiting the amount of masks that you use, because I mean, who knows how long we're going to have to ration these out for ourselves if you even have access to any. We don't know when we're going to be able to have a lot of great access to masks and PPE in general. So it's definitely quite a conundrum.
Yeah. So it sounds like, just to kind of get to the core of it, like really silencing out all the noise, focusing on the sources that really know what they're talking about, and then kind of back to what Vanessa was talking about with, having the proper, and Kristen was talking about as well, having the proper PPE in place, but ultimately thinking of ourselves. It's not just about us and how our life is; it's how we affect other people's lives as well. And from on that point, maybe, and Emily, maybe you can jump into this a little bit more. What are some things you can do outside of social distancing, outside of, reading the news, that you can do to like keep your body really healthy? And I think everybody can probably jump in on this as well, but I think, what are some things that we can be doing to combat any health concerns like this?
Yeah. Like someone was saying, having a schedule is very important. So having proper sleep is number one. Getting up, take a shower, have a normal as possible day, and stay away from people. Even, like I get up, I don't leave my house. I have that luxury, and like we're saying, everybody do their part. So I can do all of my telemedicine so that it's safer for Dr. Beatty to do her stuff that has to be in the office. And that's the trade-off there. Just working together and doing whatever we can. So, and then of course we have naturopathic protocols for immune care. So call a naturopath, make a telemedicine appointment, and they can prescribe proper supplements for proper care. And then having some sort of physical activity that you do. I do online bar 3. It's like a 1-hour class, and
Brutal. I've done it with my wife. It sucks. I mean, it's in a good way.
Yeah, my husband does not enjoy doing it. And then just knowing that there is telemedicine counseling, there's telemedicine physical therapy, chiropractic, yoga. Like experiment once a week, however much time you have, find something that works for you. And I think like the yoga lady Lisa was saying, I think that is the luxury, that's the opportunity, that's the moment that we have right now. A lot of people have that. You can find something like that that works for you. You have the opportunity and the drive, and some people have the time. Some people are full-time caretakers. So.
And Lise, for you, one of the things that I really admire about your practice is that there's a very meditative aspect to it. What are some things from a perspective outside of just like what we put in our bodies? How we're like, from Adam's perspective, how are we treating prepping our bodies and maintaining our bodies when we're beating them up every day in many different ways? But how can we, we don't need to dive too much into a spiritual side, but how can we ease a lot of those things, which I think do have a physical impact on us, right?
Yeah, there's so many different opportunities for us to give self-care, and just a couple really simple things that we can do, and I teach people how to do it, and I can continue to teach people how to do it virtually, is like skin brushing to enhance the flow of the lymphatic system, which is our major immune booster within our own bodies. And people don't really know necessarily, some do, how you can enhance your immune system by that self-care technique of skin brushing. So that's one thing. Self-massage doesn't have to be complicated. We, in yoga therapy, we often promote the practice of abhyanga, which is an oil-based massage. And I like to think that if we just take the time to move through the body in an appreciative way, in a meditative kind of way. So real quickly, abhyanga, you would take an oil, an organic oil. It could be any kind you like, sesame, not roasted or toasted, but just sesame oil, and start at the top of your head and rub it in all over your body and really take your time, and it feels so good. And then allow it to sit on your skin for a little while. And then maybe after 15 minutes, take a warm shower, or if you can, take a bath, and then just dry yourself off. It feels amazing. It grounds you, helps reconnect you to just connecting with your body. And it's good for you. So little things like that we can all maybe take a little time to do.
Well, we all have more time now, which I think is...
We have the time. Like yesterday.
I agree with that. I don't think we all have all the time to do that. And I say that as a parent of two really young children who now don't have school. And I don't know how many of you have young kids at home. I know Emily does. But for the first couple of weeks after school closed, there was no doing homeschooling. There was no doing self-care. There was no doing, we were literally just trying to survive. My husband works in the hospitals. He's at St. Joe's sometimes. He's down at Providence sometimes. He's all over the place. And so for both of us having to work and have kindergarten and middle, our oldest daughter's not even in middle school yet. She's still elementary. To have that at home and be trying to layer on homeschooling and still be working full time, and having lost our childcare providers, I think people need to know that there's some grace to just not having to do all of the things, and that just because it's available online, maybe you can't tap into that yoga class online, but if you can just do some stretching with your kids, at least it's a start. But I think a lot of people don't have the time to do everything that we have to offer. And I don't know how to best to remedy that. For us, the Ferndale School District partnered with the YMCA and opened up childcare for the children of healthcare providers and other essential workers. And I would like to see more of that happening in our community. I get calls from people all the time who are almost at their breaking point with trying to work and trying to maintain home and be with their children in a way that's good and safe for them too. And I think, so that's the one thing. I'm not disagreeing that what Lisa's offering is of value, but I don't know that people necessarily have the time and bandwidth to incorporate it the way that would be ideal. And then kind of back to something else you had said too, where Emily was talking about immune support, is I feel like that's kind of the other silver lining to this whole situation, is that hopefully people are starting to kind of become more aware of what really is essential care, and reprioritize financially and with their time and their focus on healthcare. Because while we can do a lot of naturopathic things to support our immune system, it doesn't happen overnight. And so while any time is a good time to start, some people are starting kind of behind the eight ball, so to speak, in that there's a lot of work that needs to be done on foundational things to have a good, healthy, robust immune system. So anyway, I was just sorry.
No, and it's so true. It's so true.
Overwhelming trying to be a parent and work full time.
Many of my clients are parents and have their kids and are trying to figure this out. And so taking that moment of self-care, it doesn't have to be an hour. It could be just 5 minutes, just a minute, just remembering when you're feeling that anxiety coming up, and to just recognize it for what it is. Sometimes if we just put our hand on our heart and just say like, oh, anxiety. Yeah, I know you. I feel you. And acknowledging that and moving on, just taking a pause. Doesn't have to be a major chunk of time. Less is more sometimes is helpful. Yeah.
Absolutely.
And I hear you.
And Vanessa, you've got kiddos. What has it been like for you, Mike, with kids home and, you know, running? So you also are in real estate as well. And so you're doing both. So what has that been like for you, having kids at home, running your businesses, being a healthcare provider, like all of the above? There's a lot going on.
You know, it's been interesting. Our life, like most people, have been completely flipped on its head. You know, we're usually out and about all the time. My son is 12. He's in 6th grade, and he's very, very active in sports. He's an only child, and he's also extremely social. And so he's taking this way better than I thought he would. He's been, you know, he's got his moments. More than anything, it's frustrating for us when we're both trying to work, and then next thing you know, hours have gone by and we find him on a tablet or something. And I'm like, you were supposed to mow the lawn, you know, do your homework, you know, do your stuff. And so it's like there's a frustration there trying to get him to do what he's supposed to do, because he's not extremely self-motivated. And like you mentioned, like my husband Mike, he runs Bellwether Real Estate. He's also a commercial broker, and so they shut the office, and so he's been working from home, doing a lot of Zoom meetings, and, you know, trying to deal with all the Bellwether stuff. Plus, he's president of the board of BCLC, and BCLC is Bellingham Child Care and Learning Center. And so there was a lot of decisions having to be made in regards to that. So the first couple of weeks in particular were extremely stressful. And I'm really glad that that they didn't have schoolwork to do online here. It was just last week that they implemented that. So we were able to kind of position ourselves. That first 2 weeks was kind of scrambling, trying to get into a routine. Now I feel like things are more manageable. And for him, like his commercial real estate is pretty much dead right now. And my residential real estate has certainly slowed, and showings are, you know, as you know, are a lot more challenging because you can only take one person in at a time. You have to do all these different things. And so I think it's a busy in a different way. And I have tried, from the onslaught of this whole thing coming down, was I have asthma and I'm a frontline healthcare worker. So I came into this thinking, okay, I need to beef up my immune system as much as possible. So getting as much sleep as I can, trying not to be stressed, which is a really hard one. I've been doing so much more yoga. I have muscles that are sore that I didn't even know I had. You know, drinking water, taking supplements, just taking care of yourself and connecting with your family. I think, I feel bad for people who live by themselves and they don't have others, because I am hugging on my family like crazy. I'm a touchy-feely person, and I'm also extremely social and outgoing, and it has been hard for me to be in the house. So I'm just like constantly hugging my husband and my son and telling them how much I love them. And I think that really centers you. It calms your spirit, makes you feel a lot more calm. It puts things in perspective, honestly. What's important in life.
Yeah, I think we've seen a huge shift in both priorities and expectations during this time. Yeah.
Kristen, for you, what's a day in the life of Kristen at this time, not going to the office? And everybody is obviously, we've talked about like getting up, taking a shower, treating like whether your commute is now 5 steps to your second bedroom or you're working on your laptop at your kitchen table, whatever it is. What does your day look like now? How are you treating it like you're still, functioning?
I mean, it's hard because I can't even work remotely. Like there's absolutely nothing I can do with work-wise. But I have started using my planner a lot more, even though I'm not obviously going out and doing things outside. I'm making kind of daily lists of what I want to get done throughout the day. And then also like a big project list. Like I told you, I just bought a home and there's lots of little and big projects that need to be done. So I just made a big list of those and have been kind of slowly checking those off. Yoga, meditation. I got a spin bike, so I've been trying to exercise multiple times a day, take little walks in my neighborhood. But I think the to-do list and making a plan for your day is the most important thing, because if I didn't do that, then I would just sit on my couch and probably watch Netflix for the whole day, or I mean read for the whole day, which is also really nice. But yeah, just having a to-do list and being as active as I can, because I'm not being active by going out and going to work and like going to the gym and stuff. So yeah, make a list. Just try to make it as normal as you can. I just kind of have been thinking about it as like, oh, it's the weekend. Like I'm just gonna do my normal weekend routine and kind of treat it like that, instead of, oh, I'm not working for 2.5 months. Like what am I gonna do? So
it's really important. Yeah, I think it's key. I mean, you only see the upper half of me, so I look like I'm in the office. I mean, on the beach, maybe in the office, but I do also have, like, I'm wearing my slippers. I mean, there's things you can do to make your day go by in a way that's comfortable, but also at the same time feel like you're actually structured, getting something done. So I can definitely resonate with that a lot. So as we kind of close everything up, is there anything else anyone would like to say, like advice for people that are out there in the world that maybe have a false perception of what is going on, or what to do, or how to treat your body? Is there anything in closing that anyone would like to say?
I just think it's really important that people I know this isn't easy for anybody, but it is so extremely important that we keep doing what we're doing, staying at home, social distancing. Anytime I even remotely think about what if I just this, I think about other people, and I think about what if I just went on that walk and we were like, we were trying to keep our 6 feet with a friend or something. And then what if I find out I had COVID? Maybe I'm sick the day later. And then I have to go back and figure out who I could have infected possibly. Mm-hmm. And that's just shuts my brain down from even thinking about doing those things right now, because I couldn't live with myself if I did something that infected someone else, and God forbid I were to kill my mother or a friend or any of those things. I just as a healthcare provider on the front lines, I've seen people dying of this. I've seen how horrible it can be, and I feel a weight kind of all the time. And so I just want people to keep on doing what they're doing. I know it's hard. I know it's not easy. Just please stay at home, wash your hands, go out minimally when you need supplies. I mean, try to put everything in once a week, do your grocery shopping, or once every 2 weeks, or as far out as you can spread that. We don't want to overwhelm the healthcare system, and it could happen really easily. I mean, look at New York. They're just drowning over there. So if we just keep doing what we're doing and we can keep our hospital relatively empty, I think that's a good sign that we're all doing our part.
Yeah. I think Vanessa totally nailed all of that. And I think if we can take comfort in knowing that we're not alone in this, that, and I know I have friends all over the globe, and I do follow what is going on with them, and we're all going through it together at the same time, though distanced. And that gives comfort, realizing that while we might be isolated, we're not alone.
Agreed. Yeah, absolutely. It's interesting though. We've even found a way to become more connected. My mom was laughing about it and saying, social distancing to me sounds like the wrong word. It's really social togetherness, like because everybody's actually interacting more than we've probably interacted, even though it's electronically. Then I mean, I've been talking to friends, family, people like you. I get to meet new people that I may never have met or may have bumped into in 10 years that we get to talk today. So there's lots of different silver linings as far as communication with other people go and connectedness goes.
Yeah, for my dad to get on Marco Polo, that was a big one. That would take a pandemic. So I'm grateful for that.
That's awesome. That's awesome. Anybody else in closing?
I'd say just focus on controlling the things you can and do your best to not worry about the things that are out of your control. I know that everybody's struggling in their own way, and that's I think it's a pretty good blanket statement. I think it fits into everybody's life, no matter what your situation is. You just have to do your best to just control what you can. We're all in this together. I don't think there's a single person who hasn't been affected by this in some way. So, that's where I would leave it.
Yeah, I would just encourage people that if they have reached out to their healthcare providers and haven't been able to get the support that they need, obviously all of us have connections with each other and other providers in our circle of influence, and to just keep reaching out, because I mean, I'm sure most of you can attest to having had patients come in your practice and voice their frustration with other providers they've had in the past who didn't meet their need. And so I feel like while it's really hard to be your own advocate, I think that's another thing that's really shifting with this situation, is that people are realizing that they do have to actually be their own health advocate. And so if you're not getting the solutions and the answers that you need where you're at, reach out, because what I tell people all the time is my specialty is so narrow and so focused that I may not have the answers or the tools for that person, but I almost always know someone who does and can connect them. And so I feel like with this staying at home, it can feel very alone and isolated, but that there are people who can help and support you if you get connected.
That's a really powerful way of saying that. I don't know everything. This is my focus. Here's what I can do to provide. If that fits your need, then great. If not, here's somebody that can. So that's pretty powerful. Mm-hmm. Anybody else before we sign off here?
I just try to find a new sense of normalcy, I guess. Try to find excuses to curl your hair and put on a real shirt. Make yourself feel like normal. If you live with somebody, if you live with your spouse or boyfriend or roommate, anybody, find a night, dress up, make dinner, have a movie night, try to make it feel like normal, just for your mental health sake. And actually saw a really nice quote online the other day that I thought about. If you were diagnosed with COVID-19 and they asked you, where have you been? How many people have you been in contact with in the last 2 weeks? Would you be proud of yourself knowing that you isolated and didn't pass it on to anybody else? Or would you be disappointed in yourself knowing that you didn't follow the guidelines, went out, met up with friends, you know? So that really impacted me. So I just hope other people will kind of take that and better themselves and follow the guidelines just for the sake of for everybody.
Agreed. Very much agreed. Well, thank you all for joining us. I'm going to go ahead and stop the recording now.